The first major COVID challenge for Illinois' top doctor came 3 years ago tonight, as a patient fresh from Wuhan, China, entered a Hoffman Estates hospital, becoming the second COVID patient in the U.S.
Dr. Ngozi Ezike sat down with our Chris Tye tonight to reflect on the scary days and also the more hopeful moments. How is she?
She's doing well, it seems like, Joe and Erica. There were three big things Dr. Ezike took away from the whole COVID experience. Protect the most vulnerable first. Education and information need to be solid to overcome misinformation and disinformation. And partnerships, she says, are life-savingly important. But there are two questions she gets above all else.
How did you learn to speak Spanish? And then the second one was, how did you hang in there so long?
That long COVID run began 3 years ago in this Hoffman Estates hospital. The second COVID patient in America checked in, and so did an army of doctors, including this one.
Yes, we probably were fearful because everything was so unknown, but we didn't have time to focus on that. I would urge you to get tested.
Her focus was following the data and advising the governor on decisions that not everyone agreed with.
Suspicious packages showing up at the house, people knocking on your door at 5 o'clock in the morning, at some point actually really feeling the need to have state police escort. Unfortunately, that was the reality.
How did you talk to your family about that?
Really tried to shield them from that. I mean, they obviously saw the car out front and were like, okay. They were kind of forced to kind of deal with what came.
She was forced to find short moments in those tense days to keep herself focused.
Short prayers all day long. I couldn't make it to the end of the day without that.
In the 3 years since, some days stand out from the rest.
The idea of actually closing down the state, where things were closing, I think one of the biggest things was that the St. Patty's Day parade was not going to happen. There's no playbook, there's no blueprint, and here I am.
There she was. Never had more eyes and judgments been made on the state's top doctor. The pressure didn't sap her energy. In fact, she says it did quite the opposite, which helps her now lead Sinai Chicago, the largest private safety net medical system in Illinois.
I am raring to go. I think I'm equipped.
You've been through the fire.
I've been through the fire. We can keep going through it. I'm a dragon slayer.
A dragon slayer. We should know Dr. Ezike, on a much more serious note, is the subject of an ethics investigation. The Better Government Association says what's at issue is a state law dealing with former state department heads who oversee contracts and then their future employment. That she works for Sinai Health may or may not be in violation of that law, but the investigation into that matter has not wrapped up. To date, we should note she has not been found to have done anything wrong. All that being said, Joe and Erica, on the virus front, she believes everything that happened in these last 3 years has set Illinois up to be in a better position for whatever may come, medically or virus related, down the road.
Well, I'll always remember her humanity and compassion and the emotion that she shared during that time, almost with every death, it seemed like.
Yeah, it seems like you can tell she's in a different space from that last interview we had with her the year prior. Boy, it seems like she's really gotten a new energy. I can understand, though, that will take a lot out of someone to be a leader like that.
But a dragon slayer.
Yes.
Thanks, Chris.
You bet.